I like to start with how do we prepare for surgery? How do we prepare for, is there any preparation for eyelid surgery, especially cosmetic eyelid surgery? Well, yeah, there is. And it is very important to not be on any blood thinners of any kind. So, what are the blood thinners? I say Advil, Motrin, vitamin E, fish oil, anything that can thin your blood is going to be uh, a negative towards surgery because obviously we don't want to get a lot of bleeding, bruising, or hematomas during the procedure, and therefore preparation is key. Okay, so it's very important not to, for instance, if you drink wine every day, I would tell you to stop the wine at least 2 weeks in advance, and that goes for any aspirin, Advil, Motrin, vitamin E, because all those medications or drugs or alcohol can stay in your system, can have an effect on your liver, and can cause you to have thin blood during the procedure. Another key thing before surgery is there's a lot of people on Ozempic or drugs like Ozempic, and it is very important that we don't want to take any Ozempic like within 3 to 4 weeks before surgery because sometimes there's extra fluid that sits in it slows down your gastrointestinal motion, and sometimes there's fluid that sits in your stomach, and you can regurgitate that during the procedure and cause an aspiration into your lung. So we don't want you to be on. I don't want you to be on anything like these inhibitors that can have, um, you know, that can cause some retention of fluid in your stomach. Now, besides that, of course, I also would prefer people not being in the sun beforehand. Having a sunburn or having a lot of sun exposure prior to surgery is not a great idea because it can cause some swelling and abnormalities. I think that, all these things are important to think about beforehand. I see we're starting to get some, what's my specialty? My specialty is I'm an ophthalmic plastic surgeon. I do also do facial plastics as well. And I'd like to answer any questions you have that may come up. Can you grab the camera for Lamar Jackson edit? I don't know what that means. What is your opinion on for-profit first hospital? What is this? Why do my eyes change colors? Sometimes they turn, sometimes blue. I don't know what that means. I mean gray. Your iris should not change colors because that. Can you say hi to Snow? Hi, Snow. Okay, are you bald? No, I'm not bald. I have hair. I have some hair, but no, I have hair. But anyway, I'm talking about eyelid surgery today, and if you have any further questions, please pop them up, and I'll answer them. I have a lot of experience. I have over 35 years' experience doing eyelid surgery, so I've been seeing every permutation. Now, in terms of the types of people who are ideal candidates, I'm not a dermatologist. I'm a ophthalmic plastic surgeon, and I do plastic surgery of the face and the eyelids. Let's talk for a second about who the ideal patient is. Okay, so there's different variations on everybody's eyelids can be a little different. Certainly, Caucasian patients have different anatomy than patients who are Asian derivation, and therefore you have to take into account their ethnicity and their natural contours of their eyelids. And if someone doesn't take that into account, then you may end up with some change that is unacceptable to you in the end, because we don't want to westernize someone who is Asian necessarily unless they request that, but it is very important to retain your ethnicity before and after the surgery, obviously. So those considerations are always thought about prior to surgery. I also want to know whether or not there's age-related changes of the eyelid that may occur. For instance, people may have droopy eyelids, and that's called ptosis, and they also have droopy eyelid skin, which would be a blepharoplasty. Now, do you have any, let's see if we have any questions I can answer here. I don't want to skip over some of the questions that are coming in. Let's see, should I stay out of the sun? How long after surgery? Yeah, after surgery, you should stay out of the sun for at least 10 days to 2 weeks. And even longer if you're going to go to the beach, because you don't want to have those fresh incisions exposed to a lot of sunlight. That can make the incisions, highlight those incisions, and make them red and pink for prolonged periods of time. So you got to be very careful after surgery to avoid sun. So if you're going to the beach, wear good ultraviolet A and B blocking sunglasses, as well as hats. And if you're doing lower eyelid surgery or any laser surgery under the eyelids, then you need to really use sunblocks to block the sun rays on your skin. Let's see, typical age for male patients. There is no typical age. You can be anywhere from 20 years old to 80 years old. It depends on what features you have that might need to be addressed. So it's not always a age-specific operation. I certainly operate on most patients between 30 and 60, but there are many people on both sides of the spectrum that I operate on. Let's see, I'm saving for a nose job. Okay, I'm not talking about rhinoplasty today. Advise people to enter medicine. Let's see, I battle through, I don't know what this says. Do you have a solution? Let's see. Are you gentle when you give a prostate exam? Okay, thank you. No, I'm not talking about prostates today. Okay, any tips on eye bags, tightening? My eyes are oversized, normal. I'm 60. Yes, you have to be very careful if you have prominent eyes and you're nearsighted, because your eyes are actually longer than the average length of an eyeball. You have to be very careful not to take too much fat on the lower eyelid, because it'll make it look abnormal. So we talk about the angle of the eye relative to the orbit itself. Okay. So you have to be very cautious if you have prominent eyes to begin with in terms of removing fat on the lower eyelids. Let's see. I have a sty in my left eye. It's been over 8 months. It doesn't hurt, but it's annoying. What should I do? Okay, so that's a subject on, this is really about eyelid surgery, but I can certainly address that subject called a sty. Well, in medical terms, that's called a chalazion. And a chalazion is a clogged sebaceous gland, which is like people who have acne of the face have sebaceous glands that are clogged up. Well, there are eyelid sebaceous glands also that get clogged up. And in those cases, I recommend strongly that, number one, you cleanse your eyelashes carefully on a daily basis. You can use these things called eyelid scrubs, which can remove some crust along the eyelashes and sometimes bacteria that can clog up those pores that allow the material to naturally exude out of the eyelid. The second thing is use warm compresses. Warm compresses can also liquefy some of that material in the gland and allow that to come out naturally. I don't believe you should push on things or anything like that, because I think that material can be inflammatory and make it worse. And then I would visit your ophthalmologist who can inject something called Canalog or steroid into those chalazions or those styes, and usually shrink them down without doing any surgery. If they don't respond, I would also recommend oral medication like a tetracycline. Just like people who have acne of the face, They can have what I call acne of the eyelid due to those things you're calling styes. In most cases, they're chalazions, and they do respond to tetracyclines like doxycycline. Okay. Do you deny service? Okay, let's see. I'm from, my office is in Manhattan on Park Avenue and in Palm Beach, West Palm Beach, Florida. What kind of surgeon are you? I'm an oculoplastic surgeon. I've done 3 fellowships in ophthalmology, oculoplastics at UCLA, the AFIP, and more fields in London. I'm thinking about having a blepharoplasty in a few months. Okay, great. I'm happy to hear that. Let's see. What kind of surgeon are you? Is this, I need the procedure done soon. I will need the procedure soon, okay? Okay. Well, we're happy to see you virtually or in person, either way, to assess what the problem is, and then we can decide if you need any surgery. I don't operate on everybody who asks for surgery. Sometimes people are not good candidates, but on the, okay. Let's talk about upper eyelid surgery. So on upper eyelid surgery, again, the considerations I think about are when people, first of all, I like to retain the distance from the eyelash to the crease, and I don't like to go way too high. I find that too many surgeons make a high crease. This is kind of ignoring what the natural anatomy is of the eyelid. So I like to make the incision slightly below the natural crease, because when it heals, it actually goes higher and ends up right where it belongs. So I actually, in most Caucasian patients, I make an incision about 6 millimeters from the eyelash margin, and I find that to be, and it ends up to be, in most cases, an excellent final result, a very natural looking result. It doesn't look over-operated on or artificial. However, in Asian patients, however, you have to make a very, very low crease, usually because that's where their natural crease naturally lies. And so you have to be very careful about the patient sitting in front of you in terms of who they are, in terms of their ethnicity, and try not to disturb anything that may make them look different from where they came from, so to speak. Now, in terms of how I operate on the eyelid, I actually measure very carefully every angle of the eyelid and every inch of the eyelid, and mark everything out prior to injecting or doing anything, because I don't want any distortion of the surgical field, so to speak, prior to making any incisions. So we always say, check twice, cut once. And so I'm always checking and measuring things. I think people who just eyeball the procedures end up with some asymmetries of the upper eyelid that can be avoided if they just take a little time and not say, well, I can do this procedure in 20 minutes and how great I am, and pat themselves on the back because they can operate in 20 minutes. That doesn't end up to be a symmetric, great result most of the time, because they end up with a little asymmetry between both eyelids. And I have patients not uncommonly come to me who request revisions of their upper eyelids because they have asymmetries. And it's harder to revise people who've had asymmetries than to do it right the first time. So let's see if there are any other questions that come in. Okay, I know someone who has, BP says, I know, one second. I know someone who had an upper eyelid and blepharoplasty, but the plastic surgeon, she is having anxiety. She should have it done with an oculoplastic surgeon. Your thoughts? Oculoplastic surgeons, there are excellent plastic surgeons and excellent oculoplastic surgeons that do cosmetic eyelid surgery. However, there are also people in both categories that don't do cosmetic surgery very well, believe it or not. Even though they're classified as plastic surgeons or oculoplastic surgeons, that doesn't mean automatically they're outstanding in what they're doing. They really have to focus and think about the cosmetic aspects of their procedure and not just take a cookbook approach to treating the patient. So you really have to seek out somebody who has a lot of experience doing cosmetic eyelid surgery. And even though they may claim they do, you still have to do your homework and find the right people. But oculoplastic surgeons in general do know how to do cosmetic eyelid surgery in general, but not universally. Okay. Let's see. Can you tell us the difference between upper and lower eyelid surgery? Yeah, lower eyelid surgery is a more complex procedure because it's generally done inside the lower eyelid. The incision is inside the lower eyelid to access bulging fat on the lower lid, and sometimes that fat is either moved and shifted, or sometimes I actually remove the fat and then I actually inject fat from your belly or your hip or your inner thigh back into your face to create a contour from the lower lid to your cheek in a continuum, so it looks more youthful. Yeah, so lower eyelid surgery is a little more complex. We also take into account whether there's laxity of the lower eyelid, and I pull on the eyelid. If it doesn't snap back immediately, then sometimes you have to have the corners tightened as well during the procedure. Let's see. Okay, let's see. Let's see. What soap is good for your eyelids? Any soap that doesn't burn your eyelids is fine. But I would say the best thing to use on your eyelids to cleanse your eyelid is you can use, I like these OcuSoft lid scrubs. I don't get any endorsement from the company, but I think those are fine. And they also have something called Oust, which is a tea tree oil scrub, which is also good because there's some little bugs that sometimes get on the eyelashes, believe it or not, called Demodex. And tea tree oil can treat the Demodex and treat what's called blepharitis, which is inflammation of the eyelashes. So those are things I recommend generally. When can I read or TV or read after surgery? You can, you can do anything with your eyes in terms of post-surgery, but it may be a little blurred because there may be ointment, swelling, and so forth immediately following surgery, but using your eyes will not hurt your eyes following surgery. You can do anything in terms of reading and so forth. Let's see. Steroids good from my eyes are small, but let's see what else. There's a lot of other questions. Okay. How long, BPS, how long after blepharoplasty should vision go back to normal? The vision should not be impacted at all. As I just said, you can get some swelling, which may blur your vision, but within a couple days, it should all go away. She has dry eyes before surgery. Should she be concerned? Yes. If someone has severe dry eyes before surgery, you certainly have to anticipate that she might have a greater degree of dry eyes following surgery, but not always. I've only seen rare cases which have gotten worse following blepharoplasty. It's very rare for someone to have worsening of their dry eyes. And I think in my case, it's because you have to be conservative about how much skin to remove, particularly in the upper eyelid, so there's no exposure of the eye when it closes. So the eye closes naturally. It should not impact your dry eyes significantly. If too much skin is removed, yes, you can have exposure and corneal drying and so forth. So after surgery, I would say that someone who has dry eyes needs to lubricate their eyes, because sometimes the muscle movement of the eye is a little slower, a little slightly impaired for a little bit until it comes back. And so you use artificial tears ointment at night, plain ointment, and it will help prevent any dryness of the cornea. Also, humidify the room. That's important. So, and stay away from the air conditioning blowing right on your face, or heat blowing right on your face. Let's see. Now, let's see. I've got yellow tiny dots on my epicanthal. What's wrong? I have tiny. Okay, so Chamchi says I've got yellow dots on my epicanthal folds, and what's wrong? So it's possible that those little yellow dots, I can't say for sure without looking at them, but it may represent something called xanthelasma, which is a condition where there's little fatty deposits in the skin itself, in the dermis. And some people have a propensity towards getting these things, and sometimes we actually remove those little deposits and excise them. But sometimes they recur. So it's not always a cure for those yellow spots, but they're not serious. Okay. Someone says, I'm a veteran. Should I trust the VA to do this procedure? Well, there may be very good doctors in the VA system, but I can't tell you if they're good or bad. Just because you're getting it free, so to speak, because of your veterans benefits, doesn't mean that the people doing the procedure are adept at doing cosmetic eyelid surgery. So I don't know. You have to do your homework. I'm sorry. Okay. Let's see. Okay, let's see here. Okay. So let's talk about what happens after surgery. So the sutures are put in. I use permanent sutures. I use what I call semi-permanent sutures, meaning I put in on the upper eyelid. I use what's called polypropylene sutures, which are pretty non-reactive, meaning it doesn't leave a lot of suture tracks and reaction to the suture. That suture comes out in anywhere from 5 to 7 days after surgery. I have patients apply a little ointment to their eyelids at least twice a day to keep it moist, and they heal very quickly in most cases, and they have minimal bruising because preoperatively, as I said, you're not on aspirin or Advil or Motrin or vitamin E, which doesn't thin the blood, so that you don't get as much bruising, and therefore you recover more quickly. On the lower eyelid, a lot of the surgery is done inside the eyelid, and I use what's called an absorbable suture, and that suture can stay in for, it stays in and absorbs by itself. It doesn't have to be removed. The upper eyelid suture does have to be removed, as I just said, in 5 to 7 days. Now, in terms of if you have other additional procedures done, it takes longer to recover. So like, for instance, if you have fat grafting, which is associated with doing lower eyelid surgery, as I said, I might remove fat bulges, but I may inject fat to create this contour, and this more youthful contour between the eyelid and the cheek. That takes, it can take several weeks to kind of quiet down, and so you have to be prepared that you may still have a lot of swelling and bruising following fat grafting that may not be associated with the eyelid surgery itself. Let's see. And there's very little discomfort regarding this procedure, either intraoperatively or postoperatively, almost no pain at all. I give patients plain Tylenol following surgery. They don't need narcotics to take away any significant pain or discomfort. The procedure itself is very comfortable, and I do this commonly I do it under local anesthesia, even with, I give patients IV Tylenol, which is an excellent analgesic, not like oral medication, and also sometimes I give some Valium. Rarely do we give out other things like ketamine to make the patient comfortable. Let's see. Let me see. Let's see. Okay. Okay, it says, my dad has swollen, droopy eyelids, feels like bumps under the eyelids. What medication should I take? Oh, can't tell you. You really have to be analyzed by a specialist to analyze what those lumps represent. They could be anything from fat to, other more serious diagnoses. So I can't give you any advice about that. Okay, let's see here. What are you, okay. How much, send me back, what are your thoughts on dissolvable sutures? Oh, on the upper blepharoplasty. What are your thoughts about dissolvable sutures on the upper blepharoplasty? I don't like absorbable sutures on the upper eyelid because I think it leaves like kind of a little reaction. So the way the body breaks down absorbable sutures is a reaction that can lead to little tiny granulomas and stuff like that, and little nodules. So I don't like any sign of nodularity on the upper eyelid after I'm done. So I don't endorse the idea of using dissolvable sutures on the upper eyelid. Let's see. Okay. Let me see. Any other questions? Okay. Okay. Okay, so I think I've kind of covered some of the bases, and if you have any other questions, we'll tune in again and talk about eyelid surgery, and keep me in mind, and I'll be happy to answer them. Thanks.